land is good, the land is fine. Gold we have, diamonds we mine. Yet we fight, we cover it all in blood. Tell me why we wallow in the mud. Africa, 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 yeah. Mama Africa, we cry for peace. Africa.
The value of a person or institution should be seen in what they give and not in what they're able to receive. Albert Einstein. For 5 years, the West African Society for Parenteral and Enteral Nutrition, WASPEN, has remained at the forefront of the fight against hospital malnutrition, championing improved nutritional care, advancing clinical nutrition practice, and advocating for better patient outcomes across Nigeria and the West African sub-region. What began in 2020 as a bold vision to transform clinical nutrition in West Africa has evolved into a remarkable story of impact, innovation, advocacy, and collaboration. Today, as WASPEN celebrates its 5th anniversary, the Society stands as a leading force in the advancement of nutrition support practice, influencing policy, strengthening healthcare systems, promoting research, and building a vibrant network of healthcare professionals committed to improving lives through better nutrition. At a time when hospital malnutrition remained largely under-recognized despite its devastating impact on patient recovery and healthcare outcomes, the Society emerged as a platform for multidisciplinary collaboration, professional development, research advancement, and advocacy for improved nutritional care. What started as an ambitious idea has grown into a respected regional organization influencing policy, practice, education, and research. Since its inception, WASPEN has distinguished itself as a dynamic professional body committed to advancing evidence-based clinical nutrition, strengthening healthcare systems, and promoting multidisciplinary collaboration. Over the past 5 years, the Society has achieved significant milestones that have elevated the profile of clinical nutrition both within West Africa and on the global stage. In just 5 years, WASPEN has established multiple strategic international and national partnerships, expanded its presence across 2 West African nations, introduced its inaugural conference book of abstracts, and secured a seat at key policy and professional platforms. These achievements reflect the Society's unwavering commitment to advancing nutrition support practice and improving patient outcomes throughout the region. A defining feature of WASPEN's growth has been its commitment to international partnerships. Recognizing that global collaboration is essential to advancing nutrition practice and research, the Society established a landmark relationship with the Indian Society for Parenteral and Enteral Nutrition, WASPEN. This strategic partnership opened new opportunities for education, professional training, research collaboration, and knowledge exchange among healthcare professionals. The collaboration was formally launched with the participation of Dr. Daphne Lovesley, Treasurer of WASPEN, whose involvement underscored the significance of the alliance and the shared commitment to strengthening clinical nutrition worldwide. Building upon this foundation, WASPEN further expanded its global footprint through its engagement with the American Society for Parenteral and Enteral Nutrition, ASPEN, becoming an active member of the International Clinical Nutrition Section, ICNS. Through these affiliations, WASPEN secured a respected place within the global clinical nutrition community, ensuring that the perspectives, challenges, and achievements of West Africa are represented in international discussions and policy conversations. On the national front, WASPEN has emerged as an influential stakeholder in Nigeria's nutrition ecosystem. A major milestone was the Society's formal introduction into the National Nutrition Technical Working Group, NNTWG, where it actively participated in the first quarter 2026 meeting held in Abuja under the theme Planning for the Lean Season, Bridging the Gap Towards the Reduction of Acute Malnutrition. The meeting provided an important platform for WASPEN to contribute its expertise to national strategies aimed at addressing malnutrition and strengthening nutrition interventions across the country. The Society has also fostered meaningful collaboration with key professional organizations. Its partnership with the Pharmaceutical Society of Nigeria, PSN, led to the establishment of a joint technical working group dedicated to integrating nutrition into pharmacy practice. During a major PSN national conference, WASPEN founder and president, Dr. Teresa Isiche Pounds, delivered a landmark presentation on nutrition support in pharmacy practice, highlighting the critical role pharmacists play in improving nutritional care. The presentation received national recognition and was formally captured in the conference communique, reinforcing the growing recognition of clinical nutrition as an essential component of healthcare delivery. Within healthcare institutions, WASPEN has championed the establishment of hospital nutrition steering committees, promoting structured and multidisciplinary approaches to nutrition care. These committees have strengthened institutional capacity, encouraged the implementation of nutrition support protocols, and helped place nutrition at the center of patient management and recovery. Through these initiatives, WASPEN has continued to demonstrate that nutrition support is not merely an adjunct to treatment, but a cornerstone of quality healthcare delivery. WASPEN's influence has also extended beyond Nigeria's borders. The successful establishment of the Ghana chapter marked a significant step in the Society's regional expansion strategy. This achievement strengthened cross-border collaboration, enhanced professional networking opportunities, and reinforced WASPEN's role as a unifying force for clinical nutrition practitioners across West Africa. By connecting professionals from Abuja to Accra and beyond, the Society continues to foster regional cooperation in addressing shared nutrition challenges. 5 years on, WASPEN's message remains clear. Better nutrition leads to better health, better recovery, and better lives. As the Society looks towards the future, its legacy of collaboration, innovation, and leadership will continue to inspire healthcare professionals across the region and reinforce the critical role of clinical nutrition in achieving optimal patient care.